This is Doug Sloan.
Hello, everybody.
He was an Army veteran, served in the Army for 21 years, correct?
Who? 21 years?
And he gets his care here at the VA.
Sure do.
We're going to ask some questions. My overall question that we're trying to get to is, do you think the Louisville VA is being open and honest with their patients about access to care? So my first question for you is, do you ever have trouble getting an appointment when you need it?
No. And let me share with you why, because I'll share with you an actual case. So I just made an appointment a couple weeks ago with even a specialty ENT, ear, nose, and throat. And the appointment was at 10:30, and believe it or not, they came out and called me back. I was able to get that appointment within 7 days of asking for it. And even when I showed up for the 10:30 appointment, I checked in at 10:15. They called me back at 10:20. I got my wonderful ears cleaned out. I can hear better. Did you say something? Yeah. And I was out by about 10:40.
All right. Do you think that the Louisville VA has a problem with access to care?
Been that it is the best access to care that I have, ever experienced. As a Army veteran, I can even be seen anywhere that I want to be seen. I can be seen on the outside, anywhere. But I choose to be seen here because I'm able to get the care when I need it, whenever I need it. So my experience has been at the Robley Rex Med Center, absolutely not. Yeah, I mean, I have access whenever I need it. Yes.
Okay.
Yeah.
So then my overall question, do you think the Louisville VA is being open and honest with their patients about access to care?
Oh, absolutely. Yes, and you can even go online and you can even see what we report publicly. Yeah, I mean, I read about it in the papers, I read about it on their Facebook site, on various social media platforms. My experience is that right here at our hospital, we're a very transparent hospital. Yeah, so I would say absolutely, yes.
All right. Well, then that's all I got. This is Michelle Griffin. She is an 18-year employee of the VA. She has worked in various parts of the hospital, so she has a lot of exposure to different areas of the VA. So, my first question is, do you think the Louisville VA has a problem with access to care?
I don't believe our VA as here in Louisville has a problem with access.
Okay. Do you think patients have issues with getting an appointment when they want it?
Overall, I don't believe that we have a problem here. I do think that sometimes maybe in some of our specialty care areas, there are possibly some issues where there's maybe some high demand or difficulty finding providers for specialty areas, maybe specialized care that is difficult to find. Providers as a whole really works hard at getting our patients care.
Why do you think there are so many VAs struggling to provide timely access to care?
I believe that one of the things that's not exposed, there's not a lot of exposure about, is that the VA has a high no-show rate. We have patients that do not show up for their appointments. They don't call and cancel, and so we have so many appointment slots that are not filled by the patient not coming in for their appointment that another patient could have had that appointment. So we generally, overall, I believe, have about a 30% no-show rate. So that's 30% of our appointment slots that are taken by patients that are not coming in for their appointments, that we could see patients that are waiting for appointments. And I believe overall, nationally, that's just a struggle that a lot of facilities can't get past, that are already struggling to get patients in, maybe provider shortages, staffing shortages, budget crunches. There's lots of things that I think play into it. But one of the things that they don't really talk about a lot is that the VA does have a very, very high no-show rate in comparison to private sector.
Okay. And then for my overall question, do you think the Louisville VA is being open and honest with their patients about access to care?
I really do. Our facility, as Doug said, is very transparent. Our director has town halls, opportunities to speak publicly. He speaks publicly to our veterans and in the community. We definitely have social media, open forums. So I don't believe that we are hiding anything, and we have a pretty open door. He has a pretty open door policy for our veterans to come and speak to him and resolve any issues and concerns that they may have. So I believe if there was a problem with access, that we would know about it and he would know about it, and we would get a handle on it right away.
Alrighty, that's all I got.
Thank you.
After interviewing two different points of view, one point of view being from an employee and the other being from a veteran, I've come to the conclusion that overall our local VA is open and honest with providing access to care for their patients. There are some problems with the specialty care, such as lack of providers, but overall our local VA does a pretty good job about being open, honest, quick with anything their patients need. The media kind of makes it seem as if they are hiding something, and I think other VAs may not be as open, but as far as our local VA in Louisville, I believe that they have done a good job of being open and honest and providing quick and efficient care to their patients.